Hey, welcome to another episode of JZTV. So I'm here today at Mayo Clinic Health System, and with me is Dr. Greg Kutcher, who's the CEO for the Southwest region. Greg, welcome.
Jonathan, it is a real privilege to be here with you today and with all of GMG.
Yeah, well, I'm glad you could join us. So you haven't always been in this role to this point where you're the CEO for the system here. It started very different for you, and your journey here is quite interesting. Talk about that a little bit.
My wife Maura and I came to Mankato in 1984. And I thought that I would be practicing in a small clinic with just one other doctor, and we essentially ran our own business. So my journey through this a little bit reflects what's happened in healthcare as well. From the clinical standpoint, I found the great things. I lived with our families. The great things can happen with connected care when things work well. For example, I think it was the first year here, I had a newborn, or about a 2-month-old, that had a mass in their abdomen. And I ended up referring that patient to Dr. Stephen Kramer, who was a pediatric urologist in Rochester.
You still remember?
I still remember. And he got great care. It was a complex case. And I was connected, our clinic was connected, everything went well. And you know, if things always went that well in healthcare, we wouldn't have had to change anything. But the truth is, healthcare has become even far more complex since those days. And there are many things nowadays that we're actually doing here so that families don't have to go to Rochester. It's less of a burden on them in these very complex situations. So to me, that's what gets me up every day, making it better.
All right, so the patient has the most efficient, most effective experience they possibly can.
And the knowledge. Back in those days, Mayo Clinic was a place that you went to. Now it's about the knowledge base of getting that right, that proper knowledge to where it needs to be.
Well, with all these resources, and we know that healthcare continues to be changing and evolving every day, what are some of those things that are really right on the edge for us that we're going to be experiencing as patients?
I think the biggest thing, Jonathan, is the ability to have virtual information and problem solving at our fingertips. So let me give an example we're doing right here today. We have over 1,500 babies born in a hospital in Mankato alone.
1,500?
1,500. And most of the time it's a joyful event, but occasionally there are surprises and there's problems. And we don't have a 24/7 specialist in sick newborns here, called a neonatologist. What we have now, though, is we have a virtual connection to our colleagues in Rochester. Because of that, we've had examples of patients that have stayed here who would have been transferred in the past.
So is that the TV camera type stuff that we hear about?
Computer, yep.
Okay.
Mayo is making a $1 billion investment. We are collectively for a unified Mayo record for all of our sites that includes a patient's ability to enter their own information, even to access their information better, to have virtual consults, to be able to video in, all of these changes. So I would say that actually electronic health record is probably the biggest change that you're going to see in the future.
So that's even well beyond the patient portal types of things that we experience today.
Yes.
Now you mentioned 1,500 babies a year. There must be a couple of other very interesting facts that would be fun to know about.
Well, for our region, you know, the one I'll really start with is the fact that we're also involved in creating, partnering with others in our community to make this a better place. We educate well over 1,000 students in our system here alone. We partner with South Central College, with MSU and others to educate nurses in their clinical care, and they can't find that kind of clinical care.
So 1,000 students?
Over 1,000.
Oh, wow. Okay.
So that helps make this a better place to live. And in our region, we have over 3,500 employees. We take care of over 30,000 patients in our emergency departments.
30,000 in the emergency department.
And we have the lowest inpatient mortality rate in all of Mayo Clinic Health System.
Okay, that sounds really good. we don't want a high mortality rate, right? We want a low one.
Yeah.
But that's fantastic. Congratulations for those kinds of achievements.
And it's really to all of our great people that work here and for being part of this community.
Ending on just one fun question. What was your first job? Because it wasn't this.
Well, so long ago, Jonathan, I can't remember. I would have to say it was 3 things. I was a paper boy, I mowed lawns, and I sold popcorn at the Rapid City Chiefs, which is like the Boondocks.
I did 2 of those 3 things. I didn't sell the popcorn.
And I was starting about 3rd grade. So,
hey, that's another episode of JZTV. Thank you for joining us. Have a fabulous week.